Winston, do you have some questions? I know you have
I had asked some of my fans to submit questions. So one of them is asking about the SNAP program and if they can't leave their house if their SNAP works for food delivery.
SNAP, in some areas it may, but we are actually, if you live in New York City, we are working with a network of emergency food programs. We're arranging for food delivery, particularly for seniors, because we don't want them outside, quite frankly, and accessing that. And so we can do that. Or we've been doing that with a lot of families. So we've developed a partnership with DoorDash and some other partners, because getting the food at home is really important.
Yes. So to access that, is that 311 again if they're in the city, or how do they reach out for that service?
There's 311, but there is 311 where you can get access to information about food, including deliveries at home. And you can also go on our website, UWNYC.org. We have a map that lists all the emergency food programs, and also a resource guide that lists all the resources for things that you might need in this instance. And like I said, we are activating access to food, particularly at home as well, in the work we're doing.
Now, some of our viewers are people who live in New York City, already involved with like Lyft, Uber, etc., but probably also interested in volunteering their time outside of that. If they were interested in volunteering to, say, deliver food or a ride to the hospital or to healthcare, or to deliver medications, because my understanding is that's another huge issue for those who are chronically ill, how can they get involved?
Absolutely. So on our website, you can send us an email, and we've been able to really activate and get resources for things like that from individuals. It's highly appreciated and impactful. And if you reach out to us, we'll connect the dots.
Awesome. And for those who might be wanting to help in terms of healthcare, so people who maybe need medications, etc., what can we do if we wanted to help provide medicines, insulin, asthma medications? My understanding from our prior conversation before the live is there's a huge shortage in medications. And of course, some people are choosing between medicine and food. How do we even start addressing that, if possible?
Right. I mean, we work with a lot of community health centers that are on the front lines meeting the needs. And so they're part of our network of community-based organizations. And, you know, what's interesting is that a lot of people in the Black community have the autoimmune, some challenges, and some of the medicines that we really counted on.
Like the hydroxychloroquine that is being touted as the miracle drug. People with lupus, etc., actually need that. They
need that, and they can't get it, and that's devastating to them.
Yes.
And so, you know, there is a huge need and demand for those things, as well as other medications. So we do have community health centers that are part of our network of community-based organizations that have those needs.
Awesome. So we will work there too. Winston, do you want to scroll through some of your comments on the live?
Well, we actually covered a lot of the questions within the talk. So I think we did a really great job of covering most of the questions that people had. So great. Really good. Really great, guys. And we're going to leave the fundraiser button up. So even after the live, you'll be able to donate and continue donating. And we just implore you to help us help those in need at this time. All hands are on deck. And I think this pandemic is proving that this is not my problem or your problem, it's our problem. There is no way to protect yourself without protecting other people, and no way to protect other people without taking care of yourself as well. You have a collective to get through this. So anything that you can do, $1 all the way up to $2,500, I think, is the cap on Instagram. $2,500 is as much as they will allow you to donate in one sitting. But anything that you can do will go a really long way to helping people in need.
Plus, you can donate your time, guys. Even if you're not in New York City, as you've heard, you can donate virtual assistance. There's so much infrastructure that needs to be put in place for virtual help, virtual education, virtual libraries. So please, 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 if you're someone who manufactures iPads, etc., get in touch with the United Way. I know there are a lot of people out there doing some really cool things with unique skills that can help. And of course, if you want to drive or volunteer services to help deliver people or goods to people in need, that is very much appreciated. Go to, Sheena, can you tell us again the website?
It's UWNYC.org, United Way of New York City.org. And someone said they can see my cat's tail. My cat's
yes,
here. It's like,
we saw it.
Like, serious.
One thing we didn't cover was that the 211 system.
Yes,
in New York City.
So we talked about 311 and 211.
311 is in New York, and 211 is all across the country.
Okay, great. And people can reach out to 211.org online, and they can dial 211 on their cell phones and landlines, whatever you have. Yeah, guys, thank you so much. Thank you so much for tuning in with us today. Anything that you wanted to say, Cindy?
Well, I think, asking Sheena to tell, for some who are listening who are, of course, today we focus on New York City, New York State, but like Sheena just said, outside of New York, the United Way is active across the United States and internationally.
Yes, yes. There are 1,600 United Ways in the United States and 1,800 around the world. So we are in every major city: Chicago, Atlanta, New Orleans, San Francisco, LA, and also in the Caribbean, in Africa. We are there. So and we are all focused on that, bringing people together to solve these problems.
Yes. And I think it's important for people to hear that, because I think in this time, for a lot of us, we're concerned about how do we vet organizations? How do we make sure that our donations go to the communities that need them? And the United Way has a long-standing track record. And as she described, for example, in New York City alone, they work with over 600 community organizations. So they've done the vetting work for you. They can tell you where your funds are going and who will use it if you have specific neighborhoods in mind even.
Absolutely. The United Way system is over 125 years old. Our United Way in New York City is over 80 years old. And as you said, we've been, this is our work.
Yes, yes. And why not have those who know the work do the work for us? And helping the people who need the help, not just the lip service, but they've proven themselves.
100%. And don't be afraid to write your congressperson. Don't be afraid to write and advocate for all the things that we've talked about today. An increase in the SNAP program, helping people get awareness to systems around them that can service them at this time. So please donate your time, donate your God-given right as a citizen and a taxpayer, and request that those monies are placed in the places that need them the most.
And spread the word. Tell your friends, tell your family, tell your social network. If you have an employer, talk to your employers about this. There are lots of employers who have programs that can work with the United Way as well. Maybe individually you don't feel like your contribution will count, but it will. And certainly if you can get a group together at work, that's an even bigger contribution. Consider it.
Absolutely. And that's what's going to get us where we need to be. It's that community, collective giving and working together. With that, we can do anything. And certainly we've got a lot to do.
Awesome, guys. Hit that donate button and give whatever you can. Thanks so much, guys. Thank you
Thank
so
you.
much, Sheena.
Thank you so much.
Kids.
So much. Appreciate you guys.
That little bushy tail back
We
there.
saw it. We were like, wants to be involved.
Don't go to that couch.
Yeah. And of course, you know, the fur babies are so important as well, even in New York. And so many people have asked. We didn't actually ask you about that. I guess as we close out and help people get to do their donations, how are people coping with the fur baby situation in New York?
Right. I mean, I think, you know, just making sure. I mean, there have been some stories of possibly pets getting sick, but hopefully that's not happening a lot. But you know, as people are sick and leaving their homes, and their pets also need care.
Yes.
But one good story is that I think a lot of dogs and cats have been adopted because people want someone to walk across the street and love up on them. But they're wonderful. We love them. They're
Yes. Yes. I'm glad to hear that. I'm glad to hear that. Well,
yeah. Well, thanks so much, folks. Thanks for tuning in, and thanks for giving and continuing to give. And we request that you just continue to support us by sharing, hitting that donate button, giving your time, contacting your network, writing your representatives, all those things. So do whatever you can. We're all in this together, and we'll come out from it stronger and way more united. Pun intended. So
live united, indeed.
So thanks so much, guys. Bless.
Thank you.
Thanks again, Sheena.
Thank you so much.
Yes. Anything you want to say to wrap it up?
Yeah.
Just that, you know, these kinds of conversations are inspiring. I feel so grateful that so many people are listening and care and are committed, and you know, just inspired that we can get through this, and we will.
Certainly.
And to follow the United Way, go to United Way NYC here on Instagram, Facebook, Twitter. You can go to UWNYC.org for their website. Again, on the website, you can find copies of the letters, the templates for what you can write to your congresspeople or your phone calls to your city administrators, your state administrators, those running for election. If they're seeking your vote, let's find out what they're going to do about this as well.
Absolutely.
Awesome. All right, guys. Stay blessed.
Thank you.
Bye.
Bye-bye.
And then it doesn't give us the option.